Power 93.7 WBLK, the People Station. I'm Yasmin Young, and this is the 2 to 6 takeover. Of course, it's time to get into our Talk at 2. So normally we don't have an expert in, it's just your opinion, sometimes my opinion. But today I think it was really, really important to bring in someone who this is their profession. This is what they deal with on a regular basis. And I've got Dr. Michael Cummings. He is from ECMC, and he has quite a few other things going on. But today we're going to talk about mental health. And the reason we're talking about this is I think it's long overdue, but every time we seem to have a school shooting or a mass shooting, two things come into play: gun control and mental health. And we can't really do much about gun control. That's more of a Congress type of thing, but we can discuss mental health. And a lot of times people say there are early warning signs, and sometimes you don't really know how to identify them, or maybe if you do identify them, you don't know exactly what to do once you identify them. So first of all, welcome, Dr. Cummings.
Thank you for having me.
So let's talk real quick about it's different when you have an adult versus a child. If a parent recognizes something maybe wrong or something amiss in their child, they can take them in. They have that authority. If you're a boyfriend, girlfriend, if you're a mother, father of a grown child, a family member, a friend, you don't have that ability necessarily to force them to seek help and maybe diagnose what might be the problem. What's the first step?
Well, I think the first step is just recognition, and that's not just in individuals who are parents, teachers, siblings, loved ones, but it's our society as a whole. You referenced at the opening that mental health is something that we can work on as a community as opposed to the gun control piece. But mental health also is a political piece as well. If you look at the disability associated with mental illness in this country and look at lost wage earnings, it's about $250 billion a year.
Wow.
That's half the military budget. So it's a community-based thing, it's a school-based thing, it's a family-based thing, it's a church-based thing, but it's also a public epidemic.
Right. So because a lot of the people that now have come forward in this latest shooting, they mentioned that there were signs that this person might have been mentally disturbed or might have had something going on that could have possibly either contributed or may have been the main factor in them harming others. And sometimes it's not them harming others. Sometimes it's them harming themselves. What are some of the signs that might be subtle signs that a family member or a friend or a loved one might notice that are happening with a person that could be an indicator?
So 1 in 5 of all individuals will be suffering from a mental illness at some point, right? And so signs vary based on what that type of mental illness is. But often it's changes from what the norm is for that individual, changes in sleep-wake cycles, withdrawing from things that they used to enjoy, repetitive and overuse of alcohol and other substances, separating from loved ones, increased levels of irritability, or behaviors that just aren't typical for that individual. All of those things, it's hard to see sometimes, right? When you go 2020 backwards and you say, wow, look at what happened. But when you see those things, those early signs are also times that ideally we can reach out, whether there are kids or adults, reach out to resources that are local to the community. So understanding those signs and then also what those early resources are. There, of course, are ways within our community and other communities to help force treatment, if you will, in certain circumstances. But by the time you've gotten to that point, we've missed a lot of ground already.
Right. Okay, so what we're going to do is we are going to open the phone line, 644-9393. You said 1 in 5 of us may experience this in our lifetime. So I'm sure that someone listening right now may see that going on in one of their family members. So I want to give them an opportunity to kind of call in and maybe get some guidance on what those signs might be that they're seeing and how they can reach out to some of those community resources. Give us a call, 644-9393. Dr. Michael Cummings from ECMC is here, and this is our Talk at 2. Power.
Hi, I'm calling because I'm an educator, and this is a kind of a structural thing that needs to be in place. We have children that have disabilities or have mental health issues, and once they graduate from high school, they're just thrown out into society. Many of these kids are become, if they don't get, I believe, Horizon services, which many of them don't qualify for, these are the children or the people become criminals who actually have a mental disability or mental health issues, because there's no structure or safeguards in place to help them once they get out of high school. You're just thrown into society. So those are your kids that are already the 1 in 5 that are already identified. But after they're out of high school, they don't receive any assistance at all unless they commit a crime or they go into a facility.
Dr. Cummings may know of some resources that you as a teacher, who is on the front line, might be able to utilize. Yeah, so
locally, one resource I'd like to point out, because it's a coalition of 15 agencies. It's the Erie County Anti-Stigma Coalition. You can look them up on letstalkstigma.org. And that is really an umbrella entity that's trying to actually get out the message so that we can get people linked earlier to appropriate services. And they have a ton of resources there to take a look at. But to the caller's point, it is often difficult, particularly individuals with significant developmental disabilities. A lot of their life is structured around their education. And depending on when that ends, anywhere between 18 and 21, the resources really just aren't out there.
Right.
By the time we get to the point of someone graduating who's really struggling with mental illness, not to say we can't try and catch them at that point, but is really about having programs and mental health programs integrated directly with the school. So there is a transition into the adult world that allows for treatment.
And a lot of times that can be a trigger too, moving from, that adolescent life into adult life, where you are now responsible for a lot more than you were maybe as a teenager or adolescent. And that becomes a stress point or pressure point in
especially
addition.
now. It's so much harder. A lot of people, come up to me and say, I'm getting older now, so maybe I'm one of these people. But there's so many people come up and say, back in my day, this didn't happen. Well, one, that's not true. It did happen, and we just didn't hear about it on social media the minute after it happened.
Right.
But two, it is so much more complicated to be an adolescent. And it's not like several generations ago that you could then immediately leave high school and get a high-paying job at Bethlehem Steel. So there's more challenges into adulthood. Very stressful time.
So were you able to grab that website? You want to give her that website one more time?
It's letstalkstigma.org. And of course, you can always call Erie County Medical Center at 898-3000 and ask for assistance and linkage there as well. But I really encourage people to take a look at the letstalkstigma.org website.
Thank you. We appreciate you. Power, who is this? Tamiko, do you have a question for Dr. Cummings?
I more or less had a comment to what you guys have spoke about. It was the fact that it is easier for a parent to recognize when something is going on with their children, and for adults that it's a little harder for other people to see their problems. I suffer from PTSD as well as anxiety and depression due to a lot of trauma. And then I didn't get no help until I got older. It was ignored for me for a long time. And it's a hard situation to deal with. And people think that it's a joke, because I've also tried to take my own life more than one time because I felt like no one was there and cared about how I was feeling.
Right. And there are resources that are out there, and please, Dr. Cummings, give her that web address and anything else.
And also, so locally, one of the coalition partners is Erie County Crisis Services. Their number is 834-3131. When we're talking about adult loved ones, particularly if we're getting to a part where it's becoming more emergent, Crisis Services has the ability to talk to you by phone, to come directly out to your house, and in rare circumstances, if certain criteria is met, actually mandate your evaluation at a psychiatric emergency room. It's a difficult process for families to experience at times, but it's a resource out there that can be very helpful.
So,
I understand that, because I am seeking counseling and see a psychiatrist. I do, have to deal with medication. And now that my son is 17, we found out about diabetes, and I've seen that he's, starting to have the same problems, the depression and everything. So I am using those resources, and I just wanted to say to other people, some people are ashamed to, let people know that this is what's going on in their life. But there, are resources that are good out there to use, because they're actually helping me deal with my situation.
Well, we appreciate you calling in. Thank you so much.
You're welcome. Thank you. Have a good day.
You too. Power.
Hi, my name is Andrew Marks. I'm actually currently a patient in ECMC right now with mental health issues. I just wanted to let people know that it is what you make it. You can identify somebody as having a mental health issue, but you'll never really know what's going on inside. You just got to work through the pain and the guilt and the grief to get what you want in life, and that's a fact, no matter what. If you have problems, you can get through them, and if you don't want to get through them, I will help you personally. My name is Andrew Marks. If you need help, hit me up. I'm getting out tomorrow. I love everybody, and I have love for everybody that has mental health issues. It's not easy, but it's not hard, guys. I got you.
Well, we appreciate you. Thank you so much.
Thank you.
Bye-bye. Power.
Yes, Yasmin, how you doing?
I'm well. How are you, Chill?
Oh, I see you now. I'm doing good. I can't complain. You know, I'm blessed. Anyways, I want to talk about the mental health. I mean, you said about symptoms and all that. I mean, how you get them? What's sick? What was heard? What was said for you to be all on medicine? Who did it to you? Was a doctor, jail, a judge? Who told you how to be on medicine?
So you're asking what are some of the triggers that might cause someone to have maybe a mental health challenge?
Yes. How you get them? I mean,
well, let me let the doctor answer that because I couldn't tell you, but Dr. Michael Cummings from ECMC can answer that. So, doctor.
Yeah, so there's a lot of factors, right? There's genetic, there's environmental factors. Genetically alone, about 1% of the population will have schizophrenia, 2.5% of the population will have bipolar disorder, about 8% of the population will have major depression, more for anxiety disorders. Certainly, if you have a family component where you have a lot of relatives with these conditions, you're at higher likelihood. A caller earlier, though, talked about trauma, and trauma is a huge part of both mental illness as well as chronic illnesses that go along with it. People who've experienced trauma have about 2 or 3 times higher likelihood of having diabetes and other pieces. So it's multifactorial from where it comes from. And the important thing is, if you get involved with the mental health system and working with your professionals, having a thorough examination evaluation, because the treatments for these conditions will in some ways be based on how they came about. Okay. And so it's not as simple as you have diagnosis A and you get medicine B. Right. It's not that simple. Right. And medicine's not the only answer, by the way. Medicine, therapy, community supports, family, school, home, church supports, all those things have an equal value.
Chill, I appreciate you calling in. Thank you.
Okay, yeah.
Bye. Power.
I have a question for the doctor. I've been listening to Alan Nathan here for years, and they talk about the children that's indifferent to everybody else. I have people over at Buffalo State that deals with those problems. So that's what I wanted to ask the doctor about Buffalo State evaluation system. That's all I got to say.
Yeah, so there's a bunch of really good evaluation centers around, and that's certainly one of them. A lot of times when we're looking at individuals who, to your phrase, are indifferent or interacting in a different way than we expect, often those individuals are actually on the autistic spectrum as well, and can be anywhere from tremendously gifted to severely developmentally disabled and everywhere in between. It just speaks again to the need for early evaluation, as early as there are changes in milestones, developmental milestones, walking, talking, speaking, because the earlier the evaluations we get, the better these individuals tend to do long term.
That's all I have to say.
Thank you, Arthur. We appreciate it.
You're welcome.
We definitely appreciate everyone calling in. Dr. Cummings, before I let you go, again, give some of those symptoms that people can look out for in their loved one, those changes, and then some of the resources that are available for people who see somebody else who might be going through something, or for someone who's going through it right now. So
I would say is anytime we see amongst ourselves or with our loved ones changes in typical behavior, changes in sleep patterns, increased levels of irritability, withdrawal from things that we used to like to do, certainly statements about self-harm or harming others, those are all things that matter. If you look at individuals even with just bipolar disorder, which is about 3% of our population, 60% of individuals do not get proper treatment, and of the people who do even get proper treatment, only about 60% of them have adequate treatment within that level. So one of the best resources out there is the Erie County Anti-Stigma Coalition. It's at letstalkstigma.org. The whole point of it is to reduce stigma, increase the conversation, and link people to appropriate resources. You simply do not have to acquiesce for inappropriate care. There are resources out there that can help you and your loved ones.
All right. So you got it. And what's the website again?
It is letstalkstigma.org.
Letstalkstigma.org. Thank you so much for being here and representing ECMC and helping us have this conversation about mental health. Thank you.
Thank you.